Yeah, so this is a concept that goes back to our scientific founders who had been working on a couple of different approaches of peptide biology, one being using peptides to block protein-protein interactions, the other exploring peptide sequences that could be cleaved by enzymes we call proteases. And our founder took the intuitive leap of thinking that if you took an antibody and you used a peptide to block antibody binding to a target, and you also incorporated this protease cleavable sequence, a protease substrate, you could make an antibody that was initially inactive until it activated by proteases. Right. So this technology has been, we've obviously applied it in oncology where proteases are dysregulated, proteases cleave off the mask, allowing the antibody to do its business only in the tumor.
And as we'll describe further, you're doing this with like a lot of different modalities, antibody drug conjugates, bispecifics, cytokines, all of that. So this is kind of like essentially like the epitome of precision medicine. Like make sure that the drug is only active like at the site of the cancer. How do you know that it is? Like what is it about the tumor specifically that cleaves that barrier? And why would that not happen at other place in the body where you don't want it to happen?
Yeah, well, this has been a field where CytomX has really led, and we've really achieved every first in the clinic. So the very first masked antibody that was ever entered into the clinic was our probody, as we call them, probody therapeutics, called pacmillimab. It was targeting PD-L1, and we demonstrated with that probody, first of all, that the mask stays on in circulation in patients. Secondly, that the mask is removed in on-treatment biopsies. Thirdly, that the drug has significant anti-tumor activity that actually looked roughly equivalent to the unmasked antibody, as we knew at the time. And then also, we had a low rate of immune-related adverse events. And so this was the really key learning for the field, and the actual direct measurements in those tumor tissues of the protease removal of the mask, I think was a foundational achievement. And I think that's been a large part of why we've now seen many others enter the space.